arthroscopy of the left knee. So you can see where we're cranking into valgus to be able to get the best view of the medial compartment where she has a peripheral medial meniscus tear. So my fellow has the GoPro on his head, and I'm performing the arthroscopy debridement of the medial femoral condyle. And you can see the setup of the Mayo. She has some articular cartilage wear on the anterior aspect of the medial femoral condyle. Another couple of sutures. The first one is like right back here. So we're now looking at the tear pattern, which is a vertical tear of the posterior third of the medial meniscus. The root is intact. I'm probing it, thinking where I'm going to put my sutures. If I can put sutures both on the tibial side and the femoral side, that balances the repair a little bit better. So you can see here where the tear propagates to the tibial side. Sometimes it'll be a little hard to tell that if you're not opening the joint up enough and changing your flexion extension. Usually you're in a little more extended position. So now to do the repair, we've done a trephination with a small rasp, and now we put this jig to put into the back of the knee, so then we can get the fast fix in without dislodging the pledget. There's a little bit of a curve to this. So we'll start off on the femoral side, and you want to get your angle and be able to see. Some of this is wiggling it around, trying to get a little better view. So I'll start this out to make sure it's in the portion of the meniscus toward me. And go all the way through the capsule. You'll feel a little pop. This is the first generation of the meniscus repair, Smith Nephew's Fast Fix. So we keep our hand down on the shaft because the shaft can bend. And then we will deploy the pledget manually. And then you can do a horizontal or a vertical. I'm using the shaft. See how if I do the handle, it really bends a lot. So in these first generations, I want to. So you don't want to grab the handle because then you can. That's a horizontal as opposed to the first one. And here's a horizontal stitch into the tibial side. Mechanically vertical, reestablish the hoop stresses, but sometimes based on the tear pattern, you need to do a horizontal. And that was a horizontal on the tibial side. I've already put the femoral side in. So now we load up this knot pusher and cutter. Pressure on your limb. This is a simple gliding suture, and then this is pass point and then cut it. So now we're probing our repair with the tibial side. We've already put a femoral side in. You want to make this as stable as possible. You can use your skid as a reducer. That can help you, or if it hurts you, then remove it. So we're on the femoral side now, and I kept my skid in to visualize and to make sure the meniscus was reduced. And then we'll do another horizontal. Again, pushing at the shaft, not at the handle. 5-7 millimeters there. That's perfect. Okay. And he starts down, and then he'll tip it up, rotate it as you go in. You have to treat the soft tissue with gentleness because these tips can pierce through the meniscus. So now just pull consistently to deliver the knot. And we'll remove the skid and then put in the knot cutter, which also is a pass pointer. So we're going to put one final suture in on the femoral side at the root, and we'll do a vertical on this. Again, you can leave the jig in, which we did in this one, to go ahead and just deliver it. It's well reduced. And for the second limb, we will take the jig out and we'll use a vertical suture and go directly through the capsule. So now we'll deliver the last knot, cinch that down and cut it. Use our pass pointer, which is also our suture cutter. 4 sutures in the posterior third vertical acute medial meniscus tear.